make sure if it's still very small and in the outer surface of the enamel. It did not cross that line yet, so we are still good. We can literally reverse that by flossing really well, brushing really well, and get some fluoride. The best time to get it actually done is when you go to the dentist and basically you get a cleaning and your teeth, are clean. There is no biofilm on it, and the biofilm, it starts to happen like around 30 minutes to an hour after the cleaning is done, and it's like a thick layer. It kind of sticks, and it's basically made of bacteria. It's made of bacteria and remnants from the plaque, and it just sits there. How come? And I just had my cleaning done. That's your teeth. That's the that's the nature of the teeth. Okay, we have to get that fluoride placed, and it's a little sticky because then it sticks to the teeth before that biofilm is formed, and it basically makes the teeth more resistant to cavities. Okay, we can still reverse the cavities if it's still in the outer layer of the teeth. Now, let's say it actually got closer now to the line. As long as it didn't cross that line, the dentino-enamel junction, we're still okay. We can still fix it. And this is when sometimes you go to the dentist and be like the dentist, I'm gonna monitor that tooth, I'm gonna monitor that tooth. And this is what I do. I usually say, I'm gonna monitor that tooth, and I'll tell the patient, you see that tooth, the second from the back, you need to floss really well. And they're like, what happens? And I show them on the x-ray, this is what's going on. And if we don't really clean it well, we are still at the early stages, it can remineralize back. There are certain also toothpaste. You can ask your your dentist, you can ask your dentist about certain toothpaste that can help in remineralization of the teeth too. Some of them, they have more minerals, some of them have more fluoride, but it helps really well with, prevention and as well as reversing those cavities too. Okay, now let's say that cavity, now that line, that gray, it looks literally like a little triangle.